Hi, my name is Beck Madigan and this is my physical activity intervention program. The participant utilised in the study was a 42-year-old male, 179 centimetres in height, weighing 86 kilos with a waist circumference of 96 centimetres. Married with no children, he works approximately 40 hours per week in a sedentary media position. The participant is a non-smoker with normal blood pressure and cholesterol levels and is classified as low risk on the ESSA pre-screening form. The participant was diagnosed 10 years ago with tonic-clonic seizures and nocturnal epilepsy, however he has medical clearance for exercise. He is currently taking 2 prescribed epilepsy medications and has since gained weight, however this is a common side effect of the respective medications. The participant has not previously participated in a structured exercise program. Based on the case study results, the participant spent an average of 8.4 hours per day engaged in sedentary behaviour between work and leisure activities. Physical activity was less than 1 hour per week of light to moderate intensity, and steps were on average 4,125 per day. As research indicates, physical inactivity accounts for over 3 million preventable deaths globally. Therefore, due to the lack of physical activity, the participant is at increased risk of developing numerous chronic health diseases. Based on the fact that the client is already in the overweight range of BMI and at a high waist circumference, the participant is at a significant risk of obesity. Additionally, high waist circumference is strongly correlated with the incidence of cardiovascular disease. As the participant is significantly sedentary, there is a strong association with increases in type 2 diabetes due to insulin resistance. Studies also correlate premature mortality with sedentary behaviours, and the participant could in fact be reducing his lifespan by nearly 3.5 days per year. Interestingly, sedentary hours increased at weekends, suggesting that participant leisure activities were predominantly sedentary in nature. Therefore, the general aim of this 12-week physical activity intervention program will be to reduce the risk of developing chronic diseases. Due to the positive association with central body fat and all-cause mortality, the goal will be to reduce the participant's waist circumference by a total of 3 centimetres to 93 centimetres. This will be under the 94 centimetre recommendation. With the 1 kilogram loss correlating to 0.9 centimetres waist circumference, this will be an achievable goal given that the total weight loss for the 12 weeks is 3.3 kilos. We will however be focusing on the waist circumference, as studies show this is a stronger risk factor for cardiovascular disease than BMI. We will gradually increase physical activity levels in order to meet the National Physical Activity Guidelines of at least 150 minutes moderate to vigorous activity per week and 2 resistance training sessions per week. This will increase muscular strength and reduce osteoarthritis, which will be critically important as the participant ages. We will increase steps to 6,125, an overall increase of 2,000 steps. Research states this will reduce the risk of cardiovascular disease by 15% and a further 5.5% reduction in the risk of type 2 diabetes. Furthermore, we will utilise standing goal reminders on his Apple Watch to ensure sedentary time does not exceed 1 hour without moving. For the initial conditioning stage of the program, the focus will be on familiarising the participant with the exercise program. The focus is on slow advancement of intensity and frequency in this first 6-week period without too many alterations to duration. This will ensure improvements while being mindful of musculoskeletal injuries and excessive muscle soreness due to the participant being unconditioned. Based on the recommendation from the American College of Sports Medicine, the maximum heart rate is set at 40 to 55% in the initial 4 weeks, before increasing to 55 to 70%. Due to the lack of resistance training, the participant was equated with bodyweight strength training exercises, and this was all programmed at high reps. As the participant has increased boredom in exercising, the focus was on multi-joint movements. This was not only to limit exercise duration, but still provide a functional and efficient workout. In addition to the above, to increase enjoyment and specifically target prolonged sedentary behaviour on the weekend, activities were scheduled with his wife on Saturday and Sunday, as the participant mentioned he liked participating in physical activity with his family. In the second half of the intervention program, we focused on progressive overload, increasing resistance, duration, and intensity. Resistance training incorporated the use of weights, and yoga was scheduled to increase flexibility, balance, and decrease stress levels. A significant limitation to this program was the pandemic COVID-19. In the current situation in Melbourne, we are still in lockdown. Gyms are closed and there is a 5-kilometre radius rule, which significantly limits our resources and the prescription available. The client has a mountain bike, is allowed to walk outside, and has a stationary exercise bike. He additionally has some 5-kilo hand weights and some water boxes weighing 10 kilos. Therefore, this was all factored into the intervention program. To ensure exercise adherence and minimise relapse prevention, the self-determination theory framework was used to enforce intrinsic motivation. Therefore, the aforementioned program was designed to allow the participant autonomy to engage in physical activity that he enjoyed. Therefore, whilst the program stated 30 total minutes of aerobic exercise, the participant was informed that he could break this down to 3 10-minute sessions if preferred. In addition, the participant can decide the mode of aerobic activity, from walking to riding a bike, giving him autonomous motivation and competence. The ability to perform the resistance or aerobic workouts during work meetings or sitting on the stationary bike watching his favourite TV program was also mentioned to increase exercise adherence. This intervention program, in turn, ensures the participant adopts behaviour modifications to increase physical activity and to minimise potential future health risks. Thank you for watching.